25th Annual YWCA Hamilton Women of Distinction Nominee Announcement, presented by ArcelorMittal DeFasco. My name is Maddie Fuller, and I'm a proud Hamilton community member and committee member for the YWCA Hamilton's Philanthropy Committee. And I have the absolute pleasure of introducing to you live our nominees in the Healthcare Hero category for our 2021 Courage of COVID special edition of the Women of Distinction Awards. This is our second of 5 nominee reveals. Yesterday, we met the 15 women nominated in our frontline worker category. And tomorrow, we will meet our pandemic innovators. Same time, same place, 1 to 2 p.m. We encourage you to use the chat function to cheer for your nominees and friends, and each of the reveals are being recorded and will also be aired on Cable 14 and Your TV Halton, and will be included on YWCA Hamilton's YouTube channel. And if you are following us online, please use the hashtags, hashtag WOD Hamilton Halton or hashtag Courage of COVID, and please follow and like YWCA Hamilton on Twitter, Instagram, Facebook, and LinkedIn. Announcing our nominees is a milestone and celebration each year. And as we plan for our reimagined Women of Distinction Awards Gala on March 4th, and following our theme of the courage of COVID, we are not going to let a pandemic stop us from taking the time to profile this year's very special nominees. To share more with us about this unique category and the motivation behind its celebrations is YWCA Hamilton's Director of Philanthropy and Communications, Sarah Ernest. Welcome, Sarah.
Thank you, Maddie. It's so wonderful to have your support this year as we announce all of our 97, I have to say that again, nominees over the course of this week. We're so inspired from the stories that we heard at yesterday's Frontline Worker Award, category award, and look forward to unveiling today's Healthcare Heroes. I'd like to recognize and thank everyone tuning in today to celebrate these remarkable women. But before we begin, would like to acknowledge that the land on which the YWCA Hamilton rests is a traditional territory of the Haudenosaunee and Anishinaabe. This territory is covered by the Upper Canada Treaties within the lands protected by the Dish with One Spoon Wampum Agreement and is directly adjacent to the Haldimand Treaty Territory. We respect the longstanding relationships with local Indigenous communities, the Mississaugas of the Credit First Nation, and the Six Nations of the Grand River. YWCA Hamilton is dedicated to advancing opportunities for learning and education and is committed to the recommendations of the Truth and Reconciliation Commission's report. I encourage all of you to recognize and acknowledge the land that you occupy, wherever you may be tuning in from. So as Denise noted yesterday, our nominee announcement reception does look a bit different this year than what we've seen in the past. Typically, we will gather and be in person to celebrate all of our nominees. Now we are pivoting like other organizations and businesses across our city and moving our events and gatherings online. Spending this time together is so important to acknowledge the work of these healthcare heroes, and that to recognize our healthcare heroes is even more important. So as a result of this pandemic, we know that more women have died than men, in part because women have been pushed to the front lines of the pandemic response. This includes the front lines within healthcare. More women than men are risking their health and safety in order to continue working. Today, we will meet the outstanding women across Hamilton and Halton who make up the Healthcare Hero category. This award honors women who are committed to ensuring the health and safety of all people within her community. Through her work in the healthcare sector, she has directly responded to the needs of individuals impacted by the pandemic. These women are doctors, these women are nurses, they are medical officers, they are workers in long-term care, and they provide patient support and advocacy. These women are called by their duty of care and show up time and time again for those who need her, and have elevated the value of physical, mental, and spiritual well-being for those that they serve. And she demonstrates leadership in her field. Women in the Healthcare Hero category have and continue to inspire and empower individuals to make positive changes in their overall health. They support the concept of healthy neighborhoods and strive to make a positive difference in the lives of others. These women have been nominated because they have stood out and they have made a difference. To the nominators tuning in, thank you for taking the time to acknowledge the achievements and the contributions of the honoree that you have nominated. I would also like to thank our presenting sponsor, ArcelorMittal Dofasco. You continue to be by our side and have made your commitment to our women at this award program and the women we serve so loud and so clear. Thank you, Richard, and to the entire team at Arcelor for your ongoing support. We can't do this without you. Now, recognizing the diversity and the strength of women is what the Women of Distinction Awards is all about. To each of our nominees here today, your name joins the ranks of over 1,500 other remarkable women. Each of you is a proven leader, and as a Woman of Distinction nominee, you'll serve as an inspiration for a new generation of women leaders. You are now part of our legacy, and welcome to our club. And joining us today, we have Rob Green with Green Benefits Group, who has generously stepped up to be the official sponsor of the Healthcare Heroes Category Award. So everyone, please join me in welcoming Rob.
Thank you, Sarah. Welcome, everybody. Thanks for having me today. And for 12 consecutive years, Green Benefits Group has been a proud award sponsor for the Hamilton YWCA Women of Distinction celebration. When we were contacted late last year about sponsoring a new award category, the Healthcare Hero Award, we immediately said yes. Supporting this award has been an incredible honor, and we really appreciate the YWCA thinking of our organization. The past year has been challenging for all of us, but especially you, our healthcare workers who have persevered amid ongoing and unprecedented change. When the government told the public to stay home, healthcare workers showed up for work. While a number of citizens were able to possibly take time off or vacation or try to regroup and refresh, you pushed through the struggle to help others. And as this pandemic continues to produce unprecedented levels of challenge, you are focused on the well-being of others. Green Benefits Group encourages all organizations to focus on the 4 pillars of health: an employee's mental, emotional, physical, and financial well-being to ensure a strong workplace and a strong workplace foundation. And we know that our healthcare personnel have been working very hard to keep their lives in balance during this ongoing pandemic. We thank you today. On behalf of my team at Green Benefits Group and everyone in our community, I want to thank you all for your dedicated work you have done and continue to do for the sake of public health and safety. To everyone here today, you are all healthcare heroes. And with that, I'd like to turn it back to Maddie.
Awesome. Thank you so much, Robin. Thank you so much for your support this year as well. So here we go, the moment we've been waiting for. I will be announcing all the names of our nominees, and then we'll have some time to do a Q&A with each of them just to help us get to know a bit more about our wonderful nominees. So our 11 Hamilton nominees for the Healthcare Hero Award are Amanda Weatherston, Cheryl Vandermark, Dr. Cheryl Vandermark, Dawn Martin, Dr. Elizabeth Richardson, Dr. Erica Robelin, Heather Harvey, Jesse Mason, Dr. Karen Trollope Kumar, who also has a Lifetime Achievement, Kathleen Leach, who is also Lifetime Achievement, Dr. Sarah Khan, and Vanessa Jarasauskas. And in Halton, we have 3 nominees for this award, and they are Andrea Pohl, Anna Polici, and Madison Bridges. A huge congratulations to all of our nominees. And again, like Rob said, you're all healthcare heroes, and thank you so much. So now let's get to know all of you a little bit more. So the way the next couple minutes are going to go is a pretty casual conversation with all of you. I'm going to ask a certain number of you certain questions, and then I'm going to open it up for the rest of everyone to contribute any of their thoughts or reflections. And if you also don't mind, once you begin your answer, please just give us a quick introduction of who you are. It's nice to have some context of all the wonderful people that we're going to be chatting to today as well. So the first question, which was a very popular question yesterday, is who nominated you and what does being nominated mean to you? And I am going to start with Amanda, if you don't mind, if you could just introduce yourself and answer that question.
Good afternoon, everyone. My name is Amanda Weatherston, and I am currently the congregate setting COVID response nurse manager through St. Joe's Hospital, but I'm also the interim director of care at Shalom at the moment. I just want to say congratulations to everyone on the panel. It is amazing to see all these very powerful, inspiring women coming together, and I just feel lucky to be a part. So who has nominated me? There was a number of people at St. Joe's, my director, fellow colleagues, and physicians, and I'm beyond honored and privileged that they thought of me. They took time out of their extremely busy days, again, working through COVID in the day-to-day, and it's just an honor. And I wouldn't be here today if it wasn't for any of them standing next to me, Zooming back to back to back for hours to hours, problem solving, looking for solutions, being creative. It's been a very long year and we've all had to work very hard, and I think pushed ourselves to do a little bit more, a little bit different, and really kind of take healthcare in a different way and work together. So I can't say enough for being nominated, and it's very special to me. So thank you, everybody.
Awesome. Thank you so much, Amanda. That's great. And Cheryl, I'm going to hand it off to you now.
Great. Thank you, Maddie. It's so great to be here, and congratulations to everybody as well. It's so wonderful to see a bunch of women up for this fantastic award. And I am in the community healthcare business. So I'm, as she said, Dr. Cheryl Vandermark, and I'm the clinic director of a large multidisciplinary clinic in Waterdown called Waterdown Village Chiropractic and Wellness Group. And I was nominated by Susan Penny and had multiple testimonies from wonderful staff and patients that came in. Susan Penny is the BIA director for the Waterdown area of Hamilton. And we did a lot of work together with small business and that as well with, as you all know, shifting and changing and figuring it all out. And it's just such an honor to be nominated with that. And I think we'll get into kind of how my part plays in that in a little bit. But just reading some of the testimonies that came in, I had some tears in my eyes talking to some of my staff saying, oh my goodness, just reading these testimonies was award enough. And so it's just a huge honor. And thank you so much. It's great to be here.
Wonderful. Thank you so much, Cheryl. Great. And Dawn, would you be able to share a bit about who nominated you?
Hi, so again, I am Dawn Martin. Congratulations to all the nominations here. Today in this moment, I think is truly inspiring. So I'm really excited to be here. I was nominated by St. Joseph's Villa's president, Don Davidson of our foundation, and our chief operating officer, Mika Ewan. The foundation and Mika are actually my idols. They are mentors to me, and I am forever grateful for their kind words and wishes. And I'm truly honored and humbled. And I think some people are feeling, this is just our job. So there's moments that I think I feel a little nervous here, but I'm so excited. And thank you to Mika and Don Davidson at St. Joseph's Villa.
Thank you so much, Dawn. I love starting off this section of this question. I think it's so great. Does anyone else, I'm just going to open up the floor. If anyone else would like to give maybe a shout out to their nominator, you can go ahead.
Sure, Maddie, if that's all right.
Yeah.
Just so congrats to everybody. It's Elizabeth Richardson. I'm a public health doctor and medical officer of health for the city of Hamilton, work with public health services. So my nominees were a group of people that I've worked with over the years, and some going back several years, some who I work with right to this day. And it was just amazing in the midst of all this and all the work that everybody's been talking about that's going on. Yes, lots of things have changed, but a lot of it's just, been nose to the grindstone, really hard work. And then to hear that some people were thinking about things and that you were being seen for the work that was being done, and especially from some of my colleagues who I hadn't seen in some time. And it was just, again, as I said, it's just really inspiring to do more. It really took me back, and it's just been an incredible honor and to be here with everybody.
Thank you, Elizabeth. And I think Anna, I saw your hand go up as well.
In practice. So my daughter, Vanessa Taylor, nominated me. She was actually nominated for the YWCA Women of Distinction Award for 2020. She was in the business leadership and entrepreneurship category. So it was amazing to be in a room. Well, that last year we were anyways, in a room with so many amazing people, so many talented, goal-oriented and powerful women. And I was completely caught off guard when I found out that she had nominated me, and a friend had also given a testimony for me on my behalf. And so after reading her submission, I was honored, and I was honored that she thought that the work that I did put me in a category with all these extraordinary women that are here today and have been here in all the past years.
Awesome. Thanks, Anna. I think it's so cool that you both got to experience this in a very different setting, but all the same, all special as well. Thank you. And Karen, I see your hand up.
Yeah, thank you so much, Maddie. And yes, congratulations to all my fellow nominees. Very exciting to be here. My nominator was a woman named Jamie Dreyer, and she is one of our clients at Body Brave. I'm a family physician and also the medical director of Body Brave, which is a Hamilton-based charitable organization focused on providing treatment and support for people with eating disorders. So it was wonderful to have Jamie nominate me. And the other people who provided testimonies were people from different parts of my career, a patient from when I was doing full service family practice, someone on our board of directors at Body Brave, and another woman who'd worked with me in community health services. So it was wonderful to read these testimonies, and you don't usually think about these things. We're just working away and doing our jobs. So it was certainly an honor, quite unexpected.
Awesome. Thank you, Karen. I see a very common theme of everyone saying, this is just what I do on a daily basis. So I'm really glad that you're taking this time to honor what you've been doing. And Kathleen, I saw your hand up too. Oh, you're on mute.
So I'd like to acknowledge my nominee, Michelle Diplock, who is my oldest daughter. As the mother of 4 girls, it's always a challenge to make sure that you're providing the right kind of mentorship. I'm a pharmacist and I own a small pharmacy, but my focus is on community and always on community. And some of the people who supported my nomination were both from my volunteer side as well as from my health professional side. And I'm actually humbled to be in such illustrious company. Thank you, Maddie.
Thank you, Kathleen. Awesome. I'm going to go on to the next question. But again, if you haven't done a showdown and you'd like to later on, please feel free to. But question is, what has inspired you throughout this pandemic? And I'm actually going to ask Heather this question first, if you don't mind.
No, thanks so much, Maddie. I'll just give a quick shout out to my nominator, who is a dear colleague and friend of mine, Lindsay Zalat. So like everybody, it's really a huge honor and humbling and a bit overwhelming to be nominated. So thank you to her for doing that. So what has inspired me throughout this pandemic are my colleagues. So like Dr. Richardson, I work in public health. I'm a team lead for our COVID-19 hotline. So if you have a question about COVID, it's my team and myself who'll be chatting with first of all. It really is my colleagues on the hotline, but throughout public health that have really inspired me. Early on and throughout the pandemic, there have been some long, difficult days, and they've always shown up and been positive, shown huge amounts of empathy and professionalism and integrity that is really inspiring. and really worked to, help each individual client as much as they could. And it's really inspiring to be in that sort of company on a daily basis. So it's been really great.
That's awesome. Thank you, Heather. And I have to say, I remember calling the COVID hotline when I was trying to plan a super COVID friendly wedding, and it was an awesome experience. So thank you.
I am so glad to hear that. We always like to help people and try and, problem solve and give them the right information that'll help them figure things out. So, because it can be really confusing at times.
Yes, thank you. Awesome. And I actually wanted to hand it back to Elizabeth as well. If you could share what motivated you, inspired you throughout this pandemic.
It's, definitely the inspiration comes from all the people that you just had experienced over the last year. And, Heather said it really well about our colleagues. They're just an incredible group of people who have stepped up, pitched in, and the courage that has gone on in the face of uncertainty, whether it's to just sort of move forward and figure out the best thing to do in the moment, whether it's people who are going out and inspecting or testing people out in the community and seeing it everywhere. It's not just, amongst our colleagues, they've been incredible, but also it's when I go to the grocery store and seeing people who are there and working, especially in those early days when we didn't quite understand it all, and they were there doing the essential things that needed to be done. When it's the people, I get to hear lots and lots of stories, of course, about what goes on in the outbreaks and the incredible courage that people have had, just trying to do their very, very best. We've had, huge limitations in terms of the number of people available to work in many situations just because of the magnitude of this, and people have just stepped up into roles, sometimes roles that they're not so familiar with, that they could just to help and to offer to help. That has been critical. And amongst all the colleagues I work with every day, the people from the hospitals, the people from long-term care, making the best decisions that they can, working together, setting aside differences, it's just amazing so that we can do the very best that we can do. And it's just inspiring to work with all these incredible people.
Absolutely. Thank you, Elizabeth. Does anyone else want to jump in on that? And feel free to use the raise hand option at the bottom too. But yeah, does anyone want to jump in on that question? Oh, wonderful. Cheryl and Karen put up your hand at the exact same time. Cheryl, go ahead.
Yeah, just similar to Heather, right? I think it's more of kind of less of what's inspired me and more of who's inspired me. And really for me, it was my team of staff and practitioners who just inspired me with their positive attitude throughout everything, their willingness to sacrifice themselves for the health of others, and just how they've been balancing their home and their jobs, and also their resiliency in the face of job uncertainty as well in the community work. Yeah.
Thank you. I like how you're focusing on the who. I really like that. Thank you. And Karen, and then Kathleen.
I think the people that inspired me the most were our clients. So people reaching out to Body Brave are people struggling with eating disorders, which are one of the most dangerous mental and physical illnesses there is. But because there's a lot of stigma around eating disorders, and often people struggling with this condition feel a sense of shame and embarrassment, it's hard for them to reach out. And so we always feel really happy when people do reach out, because the sooner they get help, the better their chances are of a full recovery. And so since COVID happened, we've had more than double the number of people reaching out for help. And we've been very impressed by their courage in facing this illness that's so tough. And then, of course, I've also been inspired by the dedication of our clinical team. We're just a small team, but everybody just pitched in, and we were able to do a lot. We switched to online services within 48 hours of the pandemic starting. And this was due to the dedication of our team.
Thank you, Karen. Yeah, go ahead, Kathleen.
So I think the thing that inspired me was my colleagues in pharmacy, both locally and across the country. I remember that very first weekend when everything started to shut down, And we knew we weren't going to be able to close our doors some way, shape, or form. We had to stay open. And all across the country, we were in working groups on Facebook and on Twitter, and we were having conversations about how to do this safely. And then afterwards, there was a local group of pharmacists, and we got together and we all worked out a plan for what we would do to make sure that there would be continuity of care for all of our patients in the event that any of us were unfortunate enough to be hit with a COVID outbreak. And again, we had no idea what the situation would be, how much protection we could get, or how much we needed. So it was my pharmacy colleagues who really, really stepped up to the plate and worked together.
That's awesome. Thank you, Kathleen. I love hearing the collaboration piece of like people that you started working with when COVID happened. You might not have worked with as closely before, and really forming those new collaborations. So thank you. I'm going to move on to another question. And again, I think a lot of people will have a lot to say about this one, but the question is, what has the COVID-19 pandemic taught you? And I actually wanted to start off with Sarah sharing some of maybe your lessons, teachings during COVID-19.
I guess, yeah, we've all had to learn, adapt, and sort of deal with this in our own ways. I think one of the things that I've learned through this pandemic, and this pandemic has taught me, is to really sort of rely on your teams and understand sort of what everyone is going through and facing, because I think this pandemic has challenged everyone in a different way. And so I think leaning in, trying to understand, how we can address the concerns of the various populations that have been impacted. I think this pandemic has made us all face that reality and taught us to sort of listen, learn, react, and acknowledge that some of the guidance that we might provide in our different realms and spheres that we are sort of maybe experts in or leaning into has to be balanced by the emotional and the mental health toll that a lot of this has had on people. So I think acknowledging that some of our decisions have had to deal with optics and anxiety and manage based on that, but still obviously relying on whatever degree of evidence we can use, given this has all evolved so rapidly and we're all learning through this pandemic and how to deal with it. So I think there's been a lot of learning for everyone, and I think just hearing and learning from the team has been what's been most beneficial for me.
Mm-hmm. Very well said. And it's so new as well. It's not like anyone had like a 101 manual. Can you quickly just let us know what your role is in the community as well? I know you just came in, so I just said before to just introduce yourself quickly, just so we know who you are.
Sorry about that.
No, it's okay.
Patient care. So I'm a pediatric infectious diseases physician, but I'm also the infection control associate medical director for Hamilton Health Sciences. So lots of different hands in different places around the community as it's impacted by COVID. Schools has been an area of priority. The inadvertent consequences that I think children have faced through the pandemic has been a key sort of ongoing red light that's been an issue for us in the pediatric world, especially.
Mm-hmm. Awesome. Thank you. And this year, I feel like with our categories this year, it is so special because people are coming from work. You're at work, you're doing your day-to-day as we are doing these nominee reveals. And I think that's really special about this year. So thank you so much. Awesome. I also want to ask Andrea the same question too, of what has COVID-19 taught you?
I think what it's taught me is that absolutely you do have to rely on your team. This is a collective adventure. Nobody does this individually. We had many meetings where we had to sit down and make the best decision we could on very limited information. And I think being transparent and supporting each other and recognizing that this is all new is a huge thing. There, at the beginning, there was no expert to turn to. And again, it's the collective team that has supported each other. And I know people have mentioned it before, just the fact that when somebody's struggling, you support them, you circle around them, you lift them up, and then they're there to do that for you when you're in a moment where you're struggling. I think this pandemic has certainly tested everybody's capacity, both mentally, physically, emotionally. And I'm just incredibly proud that I work with such a great group of people who are so accepting, and we're all here for the right reasons, which is to support our residents and our clients. Sorry, I forgot to mention, My role is I support the long-term care homes, the adult day programs, and the assisted living programs for Halton region.
Wow. Thank you so much, Andrea. Thank you. And does anyone else want to jump in on that question as well? Yeah, Amanda, go ahead.
Sorry. I think it's also taught us to slow down amongst the chaos of COVID. I'm going to say, I think it's really pushed us all to stop, really reflect and think about what we're doing. I mean, there's no best answer in the midst of everything, but it really is looking at our residents or looking at our patients, looking at our staff, looking at the family members. How is this affecting everything that we do? And really kind of stop, hold amongst everything that's going so rapidly fast. What is the best situation that we can do for each other, knowing that tomorrow it's probably going to be a different answer. So what can we do today to really make a difference, to make it safe for everybody to have the information they need? So really making a pause about what is important right here, right now.
Mm-hmm. Absolutely. That's a great point. Thank you. Okay, awesome. Oh, sorry, go ahead.
It's Dawn here. I just wanted to say something that it has taught us here at St. Joseph's Villa, is that our work in long-term care is valued and it is meaningful. And I think that nobody was naive of how hard that COVID-19 has hit long-term care residents, their families and staff. And it has taught me that we are resilient and we are a family, and again, that our work is meaningful.
Absolutely. Thank you. Absolutely. Anyone else? Feel free to just unmute. This is pretty, I feel like a little bit of a teacher being like, go ahead.
I just wanted to say that, like many have said, we've learned about just how resilient and adaptable we all are as human beings through this pandemic. But I think I also learned that it's essential to take care of yourself, not only for your wellness, but also for the people around you who depend on you to be that voice, to be that rock, that support system. I think it's easy to sort of put your foot on the gas pedal and just keep going. And I think everyone has so much on their plate, and that list that you think that you're getting through just keeps getting longer and longer. So applying the brakes sometimes and just checking in on yourself to see how you're doing, I think it's necessary and important. And then we all love what we do. And I think that, we want to keep doing the work that we do. So we really have to, press pause sometimes and just reflect and practice like self-compassion so that we can continue to do what we all love to do.
Absolutely, because burnout is real. It is real. Thank you. Awesome. I wanted to go on to another question as well of what was your motivation to continue your work, advocacy, contributions during the pandemic? And I actually wanted to hand it off to Madison, if you don't mind.
Hi, I'm Madison Burgess. I'm a paramedic in Halton region. I think what motivated me has changed probably quite a bit throughout almost the last year now. At the beginning, there was just so much work to do. I honestly, it was just kind of a get her done attitude. And as I kind of had time later on to think through it, I think what really motivates me now and through the summer when people were kind of dealing with COVID burnout and just the endurance that this required was really having a group of peers in my workplace that were very understanding of all those issues, and that were also when one of us needed a break, someone else would kind of would help out with that. And also, I know I've heard some people mention before, seeing other people in workplaces and in sectors of work that didn't have even some of the supports that we have. And even for me, some members of my own family as well, working in other frontline sectors, seeing them still go to work and be positive and continue on was really you know what, we can wake up tomorrow and do this again, because that's kind of the only option here.
Thank you for sharing that, Madison. And Heather, I'd love to hear your perspective on this as well.
So definitely I want to echo what Madison said. Having a really supportive team and knowing that even on the hard or difficult days that you've got a team behind you who's willing to support you and, you know, help you out, pick up, you know, if you need a break, they're there. Or if you need somebody to talk to about something that's happened or a difficult situation. But just also the ability to listen, and I'm really grateful for that opportunity to listen to people and their stories and to show some empathy and to connect them with what they need, whether it's information or services. And it's really gratifying and hugely motivating to be able to do that through the phone and to do it with so many people. And so that does keep you going. And when you are able to help somebody and assist them in you know, understanding what's going on, you know, tackling a difficult topic, that's really gratifying, and it really makes showing up for work helpful. You know, like Madison said, you know, just being able to show up and do the work when so many other people are, I was really honored to be able to do that, you know, to have those answers for people, and happy to do it. So yeah.
Awesome. Karen, I saw you nodding your head throughout. Did you want to share anything?
Yeah, I was also thinking about what Madison had said about showing up. And I think one of the things that really motivated me was, of course, we had this massive increase of numbers of people reaching out for help, but also we switched to online services within 48 hours. And we became kind of fascinated by this because we were using Zoom healthcare, and we discovered that we could do groups and individual consults. And all of a sudden we realized that we were reaching out to people all across Ontario, not just in the Hamilton region, including people in remote and rural areas of Ontario who otherwise would never have been able to get any help. And people in the groups really liked it. They liked being able to be at home and, you know, with their support animal and wearing their PJ bottoms and, you know, all of that. And so I was just fascinated. I didn't realize how effective virtual care could be. And I do think that's something I've learned a lot about, and I'm sure it'll change the way we practice healthcare in so many different ways.
That's great. I love that. It's really expanded, like, even the access as well. You know, for people that might not have transportation to the location of Body Brave, for example. So that's a really, really great point. Thank you. So to bring together our conversation, I actually wanted all of you to complete a sentence for me. So I'll kind of just go around to everyone. But the courage of COVID is, and I'd love to hear a word that comes to mind or even a reflection. And I'm actually going to start with Cheryl, since she is one over from me in our boxes.
Okay, so I think, to me, summing up the courage of COVID is self-sacrifice for the health and well-being of others.
That was great. Thank you. I love that.
That's my summary.
Yeah, I love that. Thank you. Awesome. Kathleen, you're next. I'm just going in order. Oh, you're on mute.
So similarly, I think the courage of COVID is all about serving the common good rather than personal gain.
That's awesome. Did you all prep these before? These are good. Amanda, what is the courage of COVID to you?
Today, no. I think today the courage of COVID for me is stepping outside your comfort zone, doing what needs to be done for the vulnerable people, for your staff, for their families, and really just helping our community.
Awesome. Thank you so much. Dawn. Oh, I don't think it's.
Sorry about that. The courage of COVID to me, and I know to the other staff that work in long-term care and at St. Joseph's Villa, is again putting others before yourself, serving the sick, and taking responsibility to advocate for seniors, the most vulnerable, the marginalized. And also courage of COVID is celebrating our successes and continuing to fight this battle.
Thank you so much, Dawn. Thank you. And Heather.
So for me, it's just the resilience in the face of so much change and uncertainty. Yeah, it's amazing to see what people have done during these difficult times when they got creative, and the amount of resilience.
I do love the good news stories that we see coming up. Thank you. And Madison.
I think for me, the courage of COVID is trying to always find a solution to a problem, and knowing it doesn't always have to be the perfect one, but doing one that's empathetic towards others' struggles and is compassionate.
Awesome. Thank you so much. And Elizabeth.
So for me, Maddie, it all still comes back to the people. It is just believing in people and what they can do, what people will do to step up, to innovate, the courage they have, and just, supporting people to do the very best that they can do. And we'll just be, delighted with the results.
Thank you so much. Yes. And I think even in this call as is, this is kind of, for me, now when I think of the courage of COVID, I'm going to be thinking of all these nominee reveals every single day. So thank you so much. Andrea.
Sorry, I just needed to unmute. I think for me, the courage of COVID really comes down to the absolutely brilliant resilience of my team, and that we continue to do the right things and support our residents and our clients and advocate for them and advocate for long-term care and making sure that we are valued. And as Dawn said, I think one of the things that has come out of this is a recognition for those working in long-term care and assisted living and other community programs, just how difficult it can be, and what an incredible group of caring individuals we have that work in this field.
Absolutely. Thank you, Andrea. And finally, Anna, and then Sarah. So go ahead, Anna. Oh, you're on mute.
I was going to say, so many have touched on some of the things that I was thinking, but I guess the courage of COVID is to, for me, is to continue to provide the care that we do to the patients and the clients and the communities, and to maintain that support system among our peers, working through this difficult time, and to really just be there for each other, to see that light at the end of the tunnel.
100%. Thank you so much. And Sarah.
I would say the courage of COVID is advocating for those who may not have access or who may not have a voice, to find sort of equitable solutions to support everyone through this pandemic, just given the differential impact that we're seeing.
100%. Thank you so much. That is a great point of really coming back to, we have to serve every member of the community, not just a few. So thank you so much. And that brings us, perfect timing, to the end of our kind of casual Q&A, get to know our wonderful nominees. So thank you to all of our nominees for being so open and for sharing all of your motivations and all of your inspiration during this time. I really, really appreciated this conversation. And thank you everyone for joining us this afternoon as well. And congratulations again to all of our healthcare hero nominees, and best of luck to you all for March 4th. So if you want to be a part of the award ceremony to see who will be named the Courage of COVID Healthcare Hero for this year's Women of Distinction, then please join us and host Tara Lightfoot on March 4th. Tickets are now on sale at ywcahamilton.org. And this year's Reimagine event includes dinner from your choice of one of YWCA's local restaurant partners, including Rascallion, YWCA's At the Table Cafe and Catering, Carmen's on the Mountain, all in Hamilton, along with the Edge Hospitality and Studebaker's in Halton. Ticket purchasers will also receive a special mystery gift box featuring the best of Hamilton and Halton, compliments of the YWCA and our partners. Your ticket will give you access to tune in to the live award ceremony in a viewing room with friends, families, and colleagues. And YWCA also has an out-of-town ticket option this year, which folks can purchase to tune in live to cheer for our nominees wherever they may be. And we also have an amazing lineup of virtual auction items launching on Monday, February 19th, and a great contest that is already on sale. So contest tickets are only $10, and you'll have a chance to win our grand prize of $1,000 cash, or one of 3 awesome prize PACs. Proceeds from the Women of Distinction Award powers the YWCA Hamilton's critical mission, and your support will change and save lives. And I have to say, YWCA Hamilton's team have done an amazing job putting together such an awesome event, regardless of the circumstances. So big shout out to YWCA Hamilton. And don't forget, join us tomorrow when we announce the nominees in our Pandemic Innovator category. Same place, same time, 1 to 2 p.m. And don't forget to register for our category reveal events, all at ywca.org, and spread the word if you enjoyed this one. And congratulations again to our nominees, and thank you as well. And have a great rest of your afternoon, everyone.